Anterior oblique weave or Judet's weave is done to image the acetabulum. Now, acetabulum is imaged by three weaves. One is AP projection, one is posterior oblique projection, that is a Lowenstein's weave, and the third one is a Judet's weave or the anterior oblique projection. Now, AP weave gives the information about the roof and floor of the acetabulum, and any fracture in the roof and floor can be detected by the AP weave. And the posterior oblique gives the posterior wall of the acetabulum, and the Judet's weave gives the information about the anterior wall of the acetabulum. Now, Judet's weave is done by placing the patient in prone position, asking the patient to rotate to the unaffected side. Now, this is the affected side, this is the unaffected side. The patient is rotating towards the unaffected side, and that's when the affected side is lifted up from the table, and the imaging is done with the cassette placed below the patient, and the centering is done just below the coccyx, at the level of just below the coccyx, and the rays are directed such a way that it is making a 12-degree angle towards the head. 12-degree of angulation done towards the head. Centering is done at the level just below the coccyx, and the image receptor is present below the patient. This is how we do Judet's wave. If the patient is in pain, or if the patient is immobile, we cannot move the patient, then we can do an posterior oblique weave, which is also called as a reverse Judet's weave, in which the patient is lying in the supine position, and we make the patient rotate towards the unaffected. This is the unaffected side, and this is the affected side. The patient rotates towards unaffected side, and the cassette is again kept below the patient, and the imaging is done such a way that the centering is done at the level of the femoral pulse, and the angulation of the X-ray is done 12-degree towards the foot end of the patient, and the imaging is done. This is called as the reverse Judet's weave. This is done if the normal Judet's weave cannot be done because the patient is immobile or patient is in pain.